Welcome, everybody, to another amazing Pulsebeat podcast that we have every single week. And we bring to you some of the most incredible individuals from across the United States, sometimes internationally as well. But I'm super excited about this beautiful lady and all the work that she's been doing for women. Selfishly, I'm super excited to learn more and hear more what she's been working on and how she's helping to guide the women to living a better life. So welcome, Kim.
Thank you. Excited to have this conversation.
So nice to have you with us on the Pulsebeat podcast. So, can you share with everybody? I would probably be amiss at sharing everything you've done, your background, who you are, because I don't know about, I could probably speak for you as well, but women are desperately looking for solutions right now. I think that our world is in a turmoil in many categories and areas, and I know that you've been helping so many of them. So, again, welcome.
Thank you. Yeah, you are so right. This is such a need for women, and that's really why I'm here. It's what I do. And interestingly, it wasn't always what I did. I spent a majority of my career in acute care medicine. So emergency acute care, worked through the front line on the pandemic. And it was really then that I was having all of these symptoms and I didn't know what was going on, but I knew it was making them all worse. And so, yeah, I ended up leaving, the urgent care after, the pandemic. I got really burnt out. I started getting sick and I'm like, what is happening to me? So a lot of women are asking those questions because they don't really know what is happening. They just don't feel like themselves. And that was me. And I think really, I just started investigating my own symptoms. Like, what is happening to me? I mean, my training in menopause, honestly, what I can remember was women in menopause may need local vaginal estrogen for vaginal dryness. That was really the extent of what I knew.
Wow. So I want to share out. I want to point that out to our audience because again, we always say, doctors and nurses, I was a trauma nurse for 22 years before I went into natural medicine as well. But, the opportunity that they had to learn about true healing and nutrition. And now you're talking about that's all you learned and that you were taught was that one liner about, the estrogen application. That's so fascinating to me.
Exactly. So I really, my background was acute situations. I didn't really understand all the hormonal shifts going on or all of the different things that would happen, as I got a little older and what was happening in perimenopause. So really, it was my own personal investigation of symptoms. And really, I went to a functional medicine practice for a short time, started seeing women that were kind of experiencing the same things. And I thought, you know what? I'm going to create my own work. I'm going to create my own practice. I'm going to get more certifications in this area because that is what is needed. And honestly, I was shocked by the lack of research in women's health. I was shocked that we were still practicing based on these outdated guidelines or flawed studies. And there was plenty of research on men and men's health, but
Right?
not so much on women. So I was really surprised by that.
Oh.
And yeah, so that's really how it all started. I created this telemedicine practice from the ground up, and I love what I do. I get to do educational only visits all over the U.S. now. I see patients in Missouri and Iowa, and yeah, so I'm finally at a place where I feel like I'm really needed, and I really enjoy what I do. So yeah.
That's amazing. So, just to reiterate, so you have your own telemedicine, and you see people remotely. That's fantastic. And we want to make sure people know how they can get a hold of you, and how we can share with everybody your work and how they can, get healthier through your guidance and so on. I think that's fascinating. Did during your I would say almost your rebirth of your mission, right? So it's focused on
Yeah.
women. Are you seeing, and this is a question that I get asked often, are you seeing that women are entering into menopause, perimenopause, premenopause earlier nowadays compared to, years ago?
I think we know more about it. I think we realize now that menopause it doesn't, we don't just reach menopause at 50, 51 when we fall
Right.
off a cliff and boom, we're there. I think we realize now that, hey, hormonal shifts start happening in our mid 30s. And that's really where education needs to start for women, kind of to what to expect. And that, hey, this shift, it's a process and
That's
it's going to
right.
take a while. And so I don't know about earlier or if just that we know more. I mean, there's certain factors where it can happen earlier. Genetics is one of them. Smoking actually can cause menopause to occur
Oh,
up to 2 years
wow. Okay.
earlier, which a lot of people don't realize.
Okay.
So there's a lot of different factors of why it could happen, autoimmune, genetic, early, premature type menopauses. But natural menopause typically on average is around 50, 51 in the US, 51 average. So I think we just know more. We know more about how early it can start and really understanding that, being educated about that. You are so much more ahead of the game than most of us were who had no idea what was happening to us during that time. So, yeah.
That's fast. That answers a lot of questions because again, awareness does raise the ability for us to become better educated and seek out people like yourself. So typically, when you have a patient that enters into your practice and goes to you for assistance during this, I heard somebody say something to me years ago, and they said, menopause is that lovely, wonderful time of a woman's life when she's glowing, and people are drawn to her because of her joyfulness. I said, I love that spin. I'm all about that.
I
But isn't
really
it
like that.
interesting when women start asking themselves, what's happening to my body?
Yeah.
And, Dr. Northrup was the first one that I really started studying when I went through my own situation years ago. And she hit the nail on the head in a lot of the things that mainstream medicine wasn't discussing. But what are some of the symptoms, if they're watching right now, what are some of the symptoms that typically they can say, I'm not going crazy. I'm not having, I'm not in Alzheimer's and I'm not bipolar. And this is part of my body's process. What are some of the symptoms that people are running into?
Well, first of all, those are some great points. And those are some very common things that women start to think. They start to think, I don't know what's wrong with me. I don't feel like myself. I
Right.
think I'm going crazy. I mean, but think about it. When we were having these things way back in the day, they literally did think women were, they quote, hysteria. It was
Yeah.
all in their head. So
Yeah.
these stigmas and long beliefs did make us doubt ourselves and question ourselves like, is this real or is this just all in my head? And I think it's validating to know that no, it's real. These shifts are really happening. They're really causing your symptoms, which we're going to talk about. And I like to make it a little simpler. It's just perimenopause are those transitional years, those where, our ovaries, they're starting to run out of eggs. Our ovarian reserve is getting a
Right.
little low. Our body's responding. Perimenopause, 2 to 10 years, this process can be happening. The average is
Wow.
about
Okay.
4 years, but it's encouraging and validating to know that it can go on and on 2 to 10 years. I mean, it's a process. And essentially, we're, our ovaries are working towards retirement. So I like to think about perimenopause, which is really broken down in 2 stages, which can be so helpful when you understand that because where you're at, what's going on can really guide treatment for that time frame. So early
Mhm.
perimenopause, you're just kind of getting into that process and your hormones are fluctuating, mainly estrogen, your main reproductive hormone, starting to really fluctuate wildly up and down, while progesterone, our nice calming hormones, trying to quietly exit the scene altogether. So those wide fluctuations in estrogen, they can rise really high and they can fall really low. So you can imagine
Mhm.
why you're having those periods of irritability, moodiness, and they're
Right.
rapid. It's kind of like PMS on steroids. It can come and go a lot faster and hit you a lot harder. A lot of times women will start noticing period irregularities. Maybe they're coming a little more frequently. They're getting a little more irritated. They are having sleep disturbances, trouble falling asleep, trouble staying asleep, low libido, memory, brain fog. They're walking in the room thinking, what am I doing in here? I don't even remember what I'm in here for. So those are some of the main things. They might start having like heavier bleeding, heavier cramping. They might have increased anxiety, excessive worry, intrusive thoughts. Those are some of the things I was having. I was like, what? Why am I thinking like this? It wasn't like me, I was like, okay. So I think it's important to realize you can have new or worsening anxiety, new or worsening depression. So that's really important. And then a little further down in the process, we're getting into that late perimenopausal year time when estrogen's starting to drop, progesterone's starting to drop. So you may skip a period. You may skip 2 periods and think, oh, well, I guess I'm heading towards menopause. And then boom, it's back. So when both of those hormones are declining, you might start really having more menopausal symptoms like hot flashes, night sweats, vaginal dryness, a lot of fatigue. Some people have joint pains, mood changes, of course, low libido, some of those same ones, vaginal dryness, skin dryness, eye dryness, everything's drying. I mean, estrogen
Right.
really impacts every organ and system in our body. So a lot of those things, brain symptoms are huge. So then you may get to menopause, which your ovaries they've done the work. They're retired now. It's, now hormones go low, they stay low, and clinically that's defined as a year with no period. So then, progressive symptoms, hot flashes can go on for several more years. Night sweats may be occurring, a lot of brain fog, vaginal
Mm-hmm.
dryness, and that genital, urinary syndrome of menopause. Those symptoms, frequent urination, urinary type symptoms might really start to progress during that later stage.
Incredible. So during the perimenopause, for those that are watching and maybe wondering, is there anything that you treat people with during that period of time, or do you wait until the estrogen drops and the lab reports show that they need, whether it be bioidentical hormones or something like that? Is that a
Well,
possibility?
I think that's a great question because there is a misconception that you have to wait until you're in menopause to get hormone therapy. But the truth is, it's so much more beneficial if you started early. So, in that early perimenopausal phase, I was telling you about where progesterone's on the decline. Sometimes just adding in some micronized progesterone can be a game changer during that time. Or if women want to use herbals, they can use Vitex as a way to support progesterone. And then, of course, diet and lifestyle and getting your sleep right, getting your stress right, all of those things that you might actually need help with. So early, a lot of times you just need progesterone. Sometimes you can add estrogen. Every situation is different. No one's is alike. But then later, when you start having more menopausal symptoms and you're more in that late phase, adding in both can really be a game changer. And interestingly, when you're in that later perimenopausal stage where you're skipping 2 months of periods, menopause is often predicted to happen within 2 years of that time. So I think that's really
Okay. So
great to
from your
know.
first sign that you're having some of these premenopause to into full menopause, it's usually 2 years around there, you think?
When you're in that later phase, when you're starting
Got
to
it.
skip periods 2 months at a time, typically you're menopausal within 2 years most of the time. Now, everyone's different. There's always
Got
different
it.
things that can happen, but I think that's kind of great to know because you can kind of understand where you're at in the process, what treatments are going to be better for you along the way. And I think it's just great to have options to treat you. And I don't think it's right to wait. I think perimenopause, the transitional years, they are some of our most symptomatic years. Those are the years we need help. I was told, come back in a year when you don't have any periods and we'll get you treated.
Oh,
What? This is the chaotic symptomatic years where
yeah,
I really need
yeah.
the help. But I just think they don't know how to treat it. So that's
Well, what was interesting, I had a couple people that knew I was doing this interview, they said, "Would you ask her a couple questions?" So here's the big one. What is a hot flash?
a hot flash is it's just there's actually lots of different etiologies of why these things happen, but it's really our hypothalamus, our temperature regulation system gets off in our brain, and the zone narrows where we just don't tolerate it as much. So we can start feeling really warm, mainly in our chest, neck, upper body. Adrenaline plays a role in that as well. So that is why you might feel your heart racing at the same time, your mind racing at the same time. And that's also a good way to realize when you wake up in the middle of the night and you're having those racing thoughts, your heart's palpitating, that adrenaline is
Right.
playing a role. Takes a while for that to get metabolized and taken care of as we get older. So you might lay there awake with all of these symptoms. So they can come to go. They can last up to 5 minutes. You can break out in a sweat. You can get chilly. You can get heart palpitations. There's targeted treatments now. Obviously, estrogen plays a role. It affects these candy neurons in our brain. And it's kind of hard to explain, but they kind of get bigger as estrogen declines. So that
Got
definitely
it.
plays a role. So there's targeted non-hormonal therapies now that can target that direct area in the brain responsible for hot flashes, which is really positive when women can't have hormone therapy or don't want hormone therapy. Um, so I think it's really interesting because not every woman has them, but every woman loses estrogen.
Right.
And that's a common thing. And that's people that kind of fight against that hormone therapy are like, well, not every woman has it. And that's true. Not every woman has it. I mean, sometimes it's these big fluctuations. Um, but interesting, estrogen does a great job of treating hot flashes and night sweats. And you really don't need a lot of estrogen to do the trick, which is pretty great too.
Well, that's awesome. I mean, it's so funny how, um, when we embark upon this journey and just the self-consciousness of what we consider to be a hot flash or even not feeling 100%, and we as women sometimes we don't say it, right? We don't admit how bad we might be feeling. So the opportunity that they have with you to be able to do a telemedicine spot and to be able to talk to someone that truly understands their journey, I think is half the battle, because it is a situation where it's very personal to many people, correct? And then also, what is the treatment? We hear so much about estrogen dominance and so on. So people are very concerned about that. Can you touch a little bit on why we don't want to be overly estrogen dominant?
Well, I think, estrogen dominance is kind of a term that, people will say that's not really
Right.
real. But back when I talked about earlier in that perimenopausal phase where we are having these big wide fluctuations in estrogen, it's not that we suddenly have so much estrogen. It's just in relation to progesterone kind of dropping and trying to leave the scene. It's that we have this imbalance. So then we have these heavier estrogen symptoms like the heavy bleeding, the excessive cramping, you know, breast tenderness is a big one. So sometimes just coming in with some progesterone can help balance that out because that's really what we want. We really just want balance.
Yeah.
No, we never really want anything unbalanced. We don't want estrogen, which is a beautiful hormone. We love estrogen because it
Right.
does so many great things. It stimulates neurons and impacts our neurotransmitters and gives us our skin glow and our moisture, and it protects our bones and our brain and our arteries. But we want it in balance. We want it to come and do its job. We want
Right.
it metabolized and broken down and excreted. We don't want it hanging around. We don't want it coming from excessive other sources. It can be stored in our fat. So we do want to be cautious. And that's why I feel like that's what's great about hormone therapy, really, when you think about it. It's like I like to hormone stack. What are the main symptoms? What's going on? Is this more of
Hmm.
perimenopausal, low progesterone symptoms? Are they having sleep disturbances, increased anxiety, and understanding their age and understanding where they're at in the transition? I kind of understand, like, let's add in some progesterone and see if that helps. We may not need to add estrogen for quite a while. A lot of
Hmm.
times in research, a higher dose of progesterone, 300 milligrams, can treat hot flashes, night sweats, and symptoms just fine. So I think it matters where they're at in the process, what's going on, hormone stacking, get them used to that, see how they're doing. If that improves their symptoms and they feel great, you might not need to add estrogen for quite a while. So I don't know if that answered your question, but
No, no, it absolutely does. So what we want everybody to understand is, to get a baseline lab report, right? To see what you are doing in your blood on paper, and then also to address the symptomology of the experience that you're going through, and then address it. And the other question was, what is bioidentical hormone therapy, and how does that differentiate from just going to get a estrogen from your gynecologist, your doctor or what have you?
that's a great point. I do want to touch on blood levels real quick because I think everybody views that differently. It's like,
Okay.
um, if you really look at medical guidelines and you're really trying to follow what it says that you really don't need blood levels to diagnose perimenopause
Okay,
because
that's interesting. Okay.
hormones are kind of fluctuating. They're not going to be the same.
Right.
They're
Right.
going to give us readings that the woman could be telling you everything under the sun to give you everything pointing to perimenopause, but the labs look fine. So I think it's important to understand that we have to treat the patient, not just a lab number. It's not wrong to check blood levels. It's just understanding that they are information, and you can't base everything on just one lab value. So I think that's important. And even in menopause, it's like if a patient comes to me and they're having every symptom in the book, I know they're in menopause. I know what their estrogen is going to look like. I know what their progesterone is going to look like. So I'm not going to make them wait to get a level if they're having severe hot flashes before I treat them if they don't have any contraindications. So just to clear that up, everybody's different on that. But I think as long as we're not just treating a lab number and we're actually treating the patient, I think that's what's important there. Bioidentical hormones, this is a huge area because you think it would be so straightforward. Bioidentical literally just means chemically structured to what our own body produces. Those hormones are typically derived from plant sources, which is great. Synthetic hormones that they used in the Women's Health Initiative studies that's found in birth control, those are synthetic. They are not chemically structured to how our body produces, like estradiol and micronized progesterone. Those are bioidentical hormones. Conjugated estrogens like Premarin, Prempro, those ones they
Right.
used in the Women's Health Initiative, those are synthetic hormones. Bioidentical, the misconception is that you have to go to a compound pharmacy to get them and that your OBGYN or your primary care cannot prescribe them. But the truth is that bioidentical hormones are FDA approved, estradiol, micronized progesterone. Your doctor can send estradiol, whether it's a patch, a cream, a ring, however you want it delivered, to your local pharmacy. You can use your insurance and get that covered. So if you want estradiol, micronized progesterone, vaginal estrogen, those can be covered by your insurance. Bioidentical hormones can also be sent to the compound pharmacy, which is pretty amazing too, they can combine estrogen and progesterone and even some testosterone and some DHEA into one compound, and you can put it on as a cream, or you can have it delivered vaginally, or even a troche, which is under the tongue. There's different ways to do it. So I think bioidentical can be either FDA approved, sent to your regular pharmacy, or sent to compound pharmacies. Synthetic hormones, I don't prescribe. I don't know who does that anymore. I think they've just, obviously in birth control, it's in there. But I think for the most part, when you think of a hormone therapy, I think most people by this point are prescribing bioidentical hormones. Um, a common question that I get a lot is, how is hormone therapy different from birth control? Why shouldn't we just be putting everybody on birth
There
control,
you go.
in menopause? There is some good reasons for it. It can be a good thing for those women having these really chaotic periods and they're having a lot of trouble with cycles and heavy bleeding. And there's a role for it. I think there's a role of medicine, in many places.
Right. Right.
Um, but the difference is that hormone therapy can be given bioidentical, different than what's in birth control, lower doses. And a lot of times we're giving estrogen through the skin, which is the safest way in my book to give estrogen because It does not raise your clotting factors. It doesn't have to go through the liver and that first pass metabolism. So you're not raising clotting factors. You're not increasing gallbladder risk, stroke risk, and some of those things because you're bypassing the liver. So you can give it in lower doses and different routes. And honestly, you don't have to suppress ovulation with hormone therapy. We're not preventing pregnancy. Hormone therapy is not going to prevent pregnancy.
Got
Birth
it.
control, synthetic hormones, they are way more potent. So, similar to what was used in the Women's Health Initiative, those hormones were more potent. Hormone therapy, birth control, you're trying to suppress ovulation. You're trying to prevent pregnancy. These hormones are just going to be more potent, more stimulating, not naturally produced like your body. So those are some big differences that are important differences to know about.
Fascinating. There's so much to the science of creating a healthy woman, right? As we continue to age. And what I think is so fascinating to me is I look around now and I see women in their 60s, even into their 70s. They're doing better self-care because I believe they're more educated and they don't want to sit there and, in a puddle full of a hot flash and be so irritable. So they're actually taking their future into their own hands. And just a little bit of the education here, I think, is going to be invaluable to women that are looking for answers. And we know that since COVID, a lot of women have been going through a lot. It has affected them in so many different ways. And so the opportunity that you're presenting to get their hormones, number one, back into balance, I think is invaluable. The other question that somebody sent me was, can you ask her how valuable testosterone is as we age? And what part does testosterone play in it?
I think that's a great question. There's so much out there right now about testosterone, and you've
There
got
is,
these,
yes.
these people are fighting, which is kind of
Yeah,
sad in my book because it's like we should be so excited right now that women's health is finally at the forefront. We are talking about it. We are
right.
advancing. We are learning. I think it's wonderful. I get frustrated with that because honestly, women get more confused. It's like, what's right?
Mm-hmm,
What's wrong? Right?
mm-hmm.
So
Yeah,
testosterone, interestingly, estrogen, progesterone, they kind of fall off a cliff at menopause. Let's just face it. When your
yeah.
ovaries are done, those levels go low and stay low. However, testosterone, that's a little different. That gradually declines as we age. It does not decline as a result of menopause itself. So our ovaries,
Interesting.
absolutely, our ovaries will continue to produce our androgens like testosterone 10 years after menopause or more. So we don't have as much as we did when we were 25. There's an overall decline, but it's just not declining as a result of menopause itself. And that kind of shows up if you see those little old women that aren't getting estrogen therapy as they age. And you might see them, they're in the wheelchair, they got a little mustache, a little beard, and they're losing their
Right.
hair. Well, that's because their estrogen is low, but their androgens are still going. So they have that kind of imbalance where they have a little androgen dominance going on. So
Got it.
that's
Okay.
because testosterone is still being produced. So those studies are, there's a lot of studies on testosterone. It's not that we don't need it. It's just that I like to focus on getting our estrogen and progesterone right first. Unless there's obvious symptoms of testosterone deficiency, very distressing low libido. It's really bothersome to them. Low muscle mass, also some evidence it can help
Right.
fatigue and energy and confidence. So there's a lot of benefits to testosterone. It's just, and I don't have any problem adding testosterone. I like testosterone and I think it can be beneficial to women. It's just that I can't find the evidence that supports having women getting higher doses and higher blood levels than they ever had back in the day when we were at our peak. So that doesn't make any sense
Yeah.
to me. I have women that come to me from getting pellets and injections, and they can have blood levels of testosterone, total testosterone, 700s. That's a man.
Wow.
That's a man's
Wow.
optimal level. You can't tell me that a woman needs that. I just don't, I won't believe it. I don't believe it. They
Right.
have side
Right.
effects,
No.
and then they get medicine to treat the side effects of the high testosterone that they're given. So I think testosterone is a beautiful thing. There's a position statement on it that really any woman can read, and it talks about testosterone, the benefits, the best way to get it, which they say the safest way to get it is transdermally through the skin, given
Got
in
it.
physiological doses for a woman. So there's no FDA approved testosterone yet, but that may be coming. I think it's a great addition for hormone therapy, especially if low libido is an issue. Doesn't help everybody. Libido is complex. There's lots of reasons women have low libido. It's
Yes.
not ever just one thing. But I think
Right.
testosterone should be given in healthy physiological doses for a female. And I think back in the day, our levels were probably 40 to 70 range. I mean, I don't believe we need testosterone
Okay.
levels in the hundreds. So be careful about that, because with that long term comes side effects. They're studying testosterone. Long term safety data is still out. So we're still learning a lot more about it. But I think it can be a great addition to hormone therapy, as long as you're doing it safely.
But work with your provider. I mean, I think that's critically important because right now there's so much misinformation. And I really appreciate this conversation because people are self medicating. People are, creating a path, what they think, to ultimate anti aging and, looking better. And sometimes it can be actually quite dangerous to the individual. So I know that there's been cases of too much testosterone in women and how harmful it's been not only on the heart but the kidneys. And the body is not prepared for high dose testosterone. But again, there's so much marketing from certain
It really
companies,
is.
and what they're putting out there without the guidance of a medical professional.
No, I think it's important to do your own research to get
Yes.
really informed about what the research really says. Because honestly, if you have somebody and they're telling you, in general, I'm going to treat you with hormones to get you to a certain blood level, I don't believe that's evidence based. And let me tell you why. I can have a certain estrogen level or a certain testosterone level and be thriving and feeling fine and having no symptoms. Do I need my dose increased because I'm not quite at a certain level? I don't think
Okay.
so. You could have that same level and have every symptom in the book. Do I tell you your level's fine? You don't need treatment? Absolutely not. So it's very individual.
That's true,
And that's
right?
why I
Yeah.
say you treat the patient, not a lab value. You pay attention to side effects. So with testosterone, androgen type high side effects, think about PCOS, what they deal with. High testosterone, high androgens. What do they have? Some metabolic issues. They have central weight gain in the middle,
Right.
acne, oily skin, hair loss where you don't want to lose it, hair growth where you don't want to grow it. You can have a
That's
deeper
so
voice that
true.
sometimes it's not reversible, and that's sad. I've had
Mm,
patients come with clitoral enlargement. Now that's not fun. Um, so
no.
I just think it's important to realize that I think honestly what's important with all of this information, misinformation, is that, and a common misconception about hormone therapy is that it's the magic bullet. I think
Hmm.
you get on hormone therapy, you're not going to age, you're not going to wrinkle, life's going to be beautiful. But the truth is, like, you really need to have real expectations about what hormone therapy can and can't do for you. It's not going to
Correct.
keep you young forever. It's not going to make you lose weight. However, hormone therapy can mitigate weight gain. It can improve metabolic health because it can improve the way your insulin works. It can lower your diabetes risk, lower your cardiovascular risk. It can treat vaginal dryness and genital urinary symptoms and protect your bones, and has a lot of great benefits. It's just that that's what we need to know. We need to know what it really can do and what it's not going to
Hmm.
do, so that women are set up with those realistic expectations. They're like, look, I've been on hormone therapy. I haven't dropped a pound. It's like, I understand that, but you might not have gained a pound. I mean, we might be improving, but it's
Yes,
just
yes.
having those realistic expectations of what it can and can't do. And I think that's what goes wrong on social media. It's that you've got those people that are like, hormone therapy is everything. And then you've got these women that can't have it, that think they're just doomed. I mean, that it's life's over. I can't have it. So I'm
Right,
just going to die and
right.
shrivel up. It's like, no, that's not true either. It's that, there's plenty of ways to improve our health, our diet, our lifestyle, are foundational. Hormone therapy is one tool that can be beneficial. I think, unfortunately, a lot of women may avoid it out of fear. We let fear and outdated research and studies guide our
Hmm.
decisions. When, if you think about it, even in those women's health initiative studies where they were using synthetic, potent hormones, nothing like our body produces, the women that were younger in that 50 to 59 age group actually had less breast cancer, less, especially in the estrogen only group. So they
Interesting.
had
Yes,
less diabetes. They had, less
yes.
colon cancer. Their brains were better. Their heart blood vessels were better. So they had all of these benefits that weren't really recognized in those studies. And that was
Mm,
within those strong, potent hormones. So I think when you're thinking about hormone therapy, it's like, I don't want to have it. I don't want to get breast cancer. It's like, that's not really true. And we really have to look at what that looks like, because breast cancer, honestly, can happen for a lot of different reasons.
correct.
One, being a female, one, aging in itself increases our breast cancer risk. Alcohol,
Mhm.
genetics, um, circadian disruption, staying up all night, that can impact our breast cancer risk. A lot of things guide our decision on hormone therapy. Heart disease is our number one killer of women.
It is.
So we kind of forget that. We kind of leave that part out. Nobody talks about that. Death is a lot of times our very first symptom. I would say that's a really important thing to consider, especially when you think about initiating hormone therapy early, like most of the time it's meant to do, where all of the benefits outweigh the risks. And it's very harmless to me to try a trial of hormone therapy. Give it 3 months, give it 6 months. The data,
Sure.
the safety profile is great 5 years, 10 years. Then you may see a slight increase in risk. So understanding that might help you think, you know what? The risks, are they really that great for me personally? Because that's what matters. No woman
Right.
shares the same risk and benefit profile. Not one woman has the same benefit and risk. So it's very harmless to try hormone therapy for a short term. Most women don't even realize how bad they feel until they get their
Mm.
hormones back. They're
You know
like,
what? That's a really good point that you just made, is that we as women, sometimes we adjust to how we feel. We make excuses. We just say, over a period of time, we just learn to compromise, correct?
that's what we're told to do. We're
Yeah,
expected
that's
to do
right.
that as women. It's just
Hmm.
a part of aging. You're just
Yes,
getting older. It just happens. And I
yes.
like to say to my patients, it's like, if a man's testicle shrunk up at 51, stopped working, game over, they go to the doctor. Do you think they would ever accept hearing, I hope you had a
Mm,
good life. You're just getting older. It's
yeah.
natural. Just
Sorry,
accept it. There's
right?
no way they would accept it.
No.
And a testosterone on every clinic, on every corner, proves they would never accept it.
Yes.
So I think women are made to feel like they should accept it. This is just how
Hmm.
it is now. And I don't believe that. I think
I don't either. I'm so happy that you're making this your I would say your life's work, because education and encouragement and supporting women, and just the fact that they are able to express themselves and not be thought of as, you know, going a little cray cray. You mentioned something else, which I think we're going to give a shout out to our sponsor. You talked about heart disease and how that's the number one. I remember when I was working in the ER, we would treat, and this was real. We would treat men and women different when they would come in with chest pain. The men, we'd hook them up to the oxygen, give them some morphine, give an EKG right away, and oh my goodness. The women, I saw many times they would pat them on the shoulder and go, are you under stress? Is this a stress time for you? Are you having anxiety, insomnia? So they would treat them differently. Happy to say, you know, 30 to 40 years later, we're doing things a little bit differently and we're paying attention. You're definitely helping that. But, you know, our sponsor, Cardio Miracle, has taken a stand in men's health and women's health. And they've done a beautiful job of introducing a product. You know, we're going to talk about how important nutrition is to the overall anti-aging, women's health as well. But this particular product concentrates on nitric oxide support in the body. And so we have had thousands of women that have started on a good nutritional path and incorporated the Cardio Miracle product, and they find that their hot flashes are diminishing. They have more energy, and that they don't have maybe the heart palpitations, and they feel better energetically, as well as being able to their fog is lifting. Well, I believe that is with over 700 nutrients and over 58 ingredients, that we have the opportunity to be able to give the body on a daily basis what it needs. And I'm so thankful for Cardio Miracle. And I know that one study I looked at years ago was just the importance of magnesium
Yeah.
as we age as women, correct?
Oh, it's so wonderful. Magnesium is just like, if a woman comes to me, they're not on magnesium, I'm like, let's try some magnesium and see if that
There you
helps. Let's talk. You made a great point about when women go to the ER. Interestingly, heart palpitations is a big perimenopausal symptom, menopausal symptom of these
Yes.
hormones. And in the ER, when I was working in the ER as well, these women would come in this midlife age with these heart palpitations and everything would be fine. And it would just be like, you're stressed, you have anxiety. But the truth is, and what women can say is, how about we rule out everything else before you tell me it's just anxiety?
Exactly.
Until you've ruled out a life-threatening cause. Once that's put aside, okay, maybe we should think about hormones. Maybe it's really happening to these women, but yet they're made to believe that it's just anxiety. I told myself, I'm not ever going to go to the ER with that problem. Oh, that's not true. I started having this racing heart, palpitations. My heart was going 120. So I did go to the ER. I was like, here I am. I'm just like one of them. But it's so scary because it's real.
It is very
It's
frightening.
really happening. They don't
Yes.
understand why. So that it wouldn't be the first. I know I definitely wasn't. And I think that's important because a lot of women go to the ER to rule out something going on with their heart, when in reality, some estrogen, progesterone can be wonderful for those symptoms and for nitric oxide. Interestingly, yeah, estrogen does impact nitric oxide. So estrogen keeps our blood vessels nice and open and dilated, our nitric oxide.
That's right.
Yep. And our vessels flexible. So that's why as we lose estrogen, our vessels can become narrow, more constricted, stiffer. So blood pressure can rise. So that supplement actually sounds like a really great thing during these years, right?
Yes, absolutely. We want to make sure that people know how to get a hold of you. Can you share your contact information? Then we'll go ahead and put it on the bottom as well.
Yeah. Honestly, it's kimheifnerwellness.com. It's super easy. You can learn all about me there. I do blogs and share information, and you can just learn more about me. You can schedule an appointment if you want. But yeah, that's a great way to find me.
Oh, thank you so
And
much.
social
I
media,
know
I'm
you.
on social media some, but honestly, I spend a lot more time blogging and seeing patients. So I'm probably not as active as I should be on social media, but I
That's
really
awesome.
love, yeah, doing this other stuff.
Well,
So
thank you so much. I know your time is precious. I appreciate you so much being on this podcast with me. And I know, I've learned a lot as well. Every day we're evolving and we're making, I love the fact that we're now having these conversations and people can openly express and exchange information, fears, concerns, and that it's no longer taboo, and that everybody's going to age and everybody goes through this. And I love some of the things that you talked about, comparing men's health to women's health. In conjunction, we have to work beautifully the orchestra has to have all instruments working, correct?
Mm-hmm.
Men and women. And I think you give hope to those that might be just starting on this path. And it's
Yeah.
not a death sentence. We can make it to the other side and feel great at the same time. And we don't have to suffer. And I really appreciate what you said about recognizing symptomology versus lab reports. Because I
Mm-hmm.
cannot tell you how many times I had been in a room and a doctor says, you know, your labs look great. But the patient said, but I don't feel good. So
Right.
the fact that you're recognizing and you're teaching people to recognize that in their own body, I think that's spectacular. So thank you.
Oh, yeah. When you talk about suffering, I think this is something interesting I've noticed with us women and other women. It's interesting if women what I've noticed, women that go through menopause, it's a total breeze. They don't have any issues. They like to tell other women that they don't need hormone therapy. They're fine. They'll get through it. So I always feel like that's really inappropriate because every woman is unique. Their
That's right.
symptoms are going to be unique. Their experiences are going to be unique. Even something like previous trauma can make somebody's perimenopause and menopausal worse. So it's very
Mm-hmm.
wrong to tell another woman how to manage their menopause and that hormone therapy won't be right for them because they didn't need it. And I think with women, we get used to accepting a certain level of suffering. We're
That's good
told
stuff. That's really good for you to say that.
we're
Yes.
told or we believe that we really have to suffer to get treatment. And then even providers will say that. How bad are your symptoms? How much are they impacting your life? Well, they're okay. I mean, it's not too bad. Well, then just move more, sleep more, reduce stress. Come back when they're really disruptive. Okay, so I
Wow.
have to wait till my symptoms are severe to get treatment. That doesn't make sense. It doesn't
Mm-mm.
make sense that we're told, just get through it. You'll get through it. Hang
Mm-mm.
in there. It's going to be okay. In my book, we weren't put on this earth and given this life to just get through. We have this idea that we're supposed to just accept it, or
Mm-hmm.
it's some
Mm-hmm.
type of personal failings of diet and
You're
lifestyle.
right.
If we have these
Yes.
symptoms, we're having difficulty managing. And that until it's finally disrupting our life and our relationships and everything else, it's okay to get treatment. Well, I don't agree with that. I feel like we were put on this earth, given this life, to live with the highest quality of life, feel great, and thrive. So
Absolutely.
we should not
Yes.
think that we have to get to a certain level of suffering to get help.
Mm.
In my book, let's use everything that we can to thrive and feel great and have the highest quality of life for as long as we are here. So if that means using some hormone therapy, using some non hormone therapy, using some herbals, some supplements like magnesium,
Yes.
focusing on diet and lifestyle, prioritizing stress, getting to the root of our stress. What's causing it? Are we not living
Mm-hmm.
in alignment with our values and what's important to us? A lot of times that's it. We are trying to take care of everybody else. So I think it's just really important to see things that can help us as a positive and not wait until things are so bad that we deem it okay to get help. So I think that's just really what I think is important. It's like you get one life. So do whatever it takes to make it the best life
Yes.
possible and
Yes.
thrive at every age. And don't listen to anybody else. Critically think, get your own information, go to reputable sources and seek a specialist. They'll tell you what your risks and benefits are
There you
for
go.
you. And it's not going to be the same as your friend or your mom or your grandma. It's like, do what's
Yeah.
right for you.
We're such individuals, but the fact that you are encouraging women to take the position of self-care, years ago, women didn't do that. They were looked at as the weaker sex and that they are not supposed to take good care of themselves. It just kind of happened naturally and everyone else came first. we're seeing women right now be in a very unique position, the sandwich generation, right? They're taking care of, they've raised their family, and all of a sudden they're taking care of their grandchildren, they're taking care of their aging parents, they're still trying to make a living. And the stress on women right now, I think, is astronomical. Not and then now you also have the homesteaders, who just, by the way, they just want to stay home and take care of their families and grow a garden and have a couple chickens. Well, that has transformed in the last 20 years. Like, I never thought I'd see the day. It's so refreshing. But
Oh,
they are taking back the ownership of their environment and their family, which I think is incredible,
yeah.
and
I
very highly
totally agree.
encouraged by the things that you shared.
I totally agree. I mean, what I feel like, and what I was, when I was going through the worst time of my life, that last year of NP school and then into the NP being into the pandemic, stress was
Oh,
just robbing me of my health
that's
and my
right.
joy. And stress and excessive worrying, it's just going to put us into the early grave. It's just going to get us sick. And, illness doesn't care how busy you are. Illness
That's
doesn't
right.
care that you have a lot
No.
to do. It doesn't care what your schedule is.
Yeah,
It doesn't matter. And we
that's
don't want
right.
to wait until we get sick to make these big decisions. That's why I say,
Hmm.
if you can't manage stress alone, get help. Use the hormone therapy, use adaptogens, things that can blunt that stress response. Use these tools that we have to improve our health while we have it, because
Huge.
priceless. And I love that saying, um, you take care of you for me, and I'll take care of me for you.
Oh,
It's like,
I love that.
it's like we can't take care of everybody. If it's your
Right.
husband, you take care of you for me, and I'll take care of me for you. It's like we all have to do our part to maintain our health. And yeah, we have to take care of
That's
our
right.
body so it can take care of us through our old age. So I think just really learning to have some self-awareness, like what areas are causing me stress? Where can I make some changes? What's not aligning with my values right now?
Hmm.
If I value health and religion or family, am I living by those values? Because a lot of times that's what's causing our dis-ease. It's
That's
unease. We're
right.
not
That's right.
living according to what we value is important in our lives. So, reflecting, I'm using something called Morning Pages right now, which I really love. It's from The Artist Way. I really recommend that book. It's a great thing.
That's
Really
beautiful.
taking time for yourself, getting outside more, enjoying nature. It
Hmm.
lowers cortisol and inflammation and stress. It's a beautiful thing. So, we didn't really get
And
into
giving
diet and
your
lifestyle, but yeah, that
and
would be a
giving yourself the permission to do that. I think we are harder on ourselves than anybody could be, and so we have mental gymnastics that we do every day, and we have our own self-imposed goals that we attempt to make. And then if we don't make them, we feel badly because of course, we add society's impression upon how we should be doing. And so I really appreciate, everything that you're saying. And we're going to go ahead and put your information on the bottom so people can get a hold of you. I'm so excited about the information that you shared. And of course, hats off and thanks to Cardi Miracle for being able to share information such as this. We know that if you don't have good nutrition, of course, your body can't heal and you can't operate on a daily basis. And the nitric oxide um, in this particular, how this particular product increases the nitric oxide uptake in the body, healing the endothelial cells in the body, the endothelial lining,
so
and
important.
adding to the ultimate wellness of an individual, and also helping them get off the couch. If a person is feeling badly, how can they go out and exercise if they don't have the energy to do so? And how do they have the energy to exercise if they can't get off the couch? So,
That's right.
it's the chicken and the egg. And I just so appreciate yourself and Cardio Miracle. And again, don't forget, reach out to this lady and don't do it by yourself because there is opportunities for us. So thank you again, Kim. You're
Absolutely.
amazing. And I'm so honored to be able to get to know you and our people as well. And again, happy trails, as we say, and the opportunity to stay better, be better, and stay healthy on a daily basis. Any final words?
Thanks for having me. And yeah,
This
I
is
think what
great.
you said exactly. We put unrealistic expectations on ourselves and they only cause us trouble. So be
That's
good to
right.
yourself. Be good to yourself. You know, we only get one life and we got to take care of ourselves. And our thoughts create our
Got that
reality.
right.
So focus on positive thoughts.
Yes. Thank you so much, Kim.
Yeah, it was my pleasure. I
And
enjoyed it.
until next time,
Yeah. See you again.
thank
Thank
you so
you.
much, everybody.
Have a great day.